Good afternoon, everybody. You are all very welcome to the launch of our research study today, the effects of COVID-19 on people experiencing mental ill health, substance use disorder, and homelessness or housing insecurity in the Dublin region. This study was undertaken by Kathyan Kelly, who will shortly tell us about the study, its findings and recommendations. This research focuses on the lives of 10 participants who engage with 2 mental health services, our own team in Merchants Quay Ireland and the HSE ACCES team. I particularly want to say a big thank you to the participants for being so courageous and sharing with Kathyan their own personal journeys and the impact COVID-19 has had on their well-being. Just before we start proceedings, if you have any questions as we go through the presentation, can I ask you please to pop them onto the Q&A. And I'd like to say I'm particularly delighted to welcome Minister Mary Butler to launch our report today. And I would like to invite the Minister to say a few words.
Paula, thank you very much for the kind welcome. I am delighted to be here today to launch this important and timely report. I would like to thank you, Paula, and the rest of the team at Merchants Quay Ireland for hosting this event and for the kind invitation to launch this report, which is a huge privilege. I was delighted to meet with members of your organisation not so long ago and to hear of all the fantastic work that you have been doing during a really difficult last 12 months. The report, which was commissioned by Merchants Quay Ireland and conducted in collaboration with HSE ACCES, examines the effects of COVID-19 on people who are homeless, in addiction services and suffering from mental health difficulties. As you will all know, COVID-19 has posed significant challenges across society, including increased stress, anxiety and fear, and not least for this particular group of individuals. It is well evidenced that homelessness can both be a cause and a consequence of mental health problems. Similarly, drugs and alcohol misuse frequently coexist with mental health difficulties. Sharing the Vision, our new mental health policy, recognises that individuals experiencing homelessness and people with a dual diagnosis of addiction and mental health difficulties should have access to appropriate mental health services and supports by addressing existing service gaps and developing stepped integrated models of care. With respect to dual diagnosis, the policy is transformative in that it reverses a problematic policy recommendation set out in a Vision for Change, which we had in 2006 for the 10 years after that. It clearly states that individuals with coexisting mental health difficulties and addiction to either alcohol or drugs should not be prevented from accessing mental health services. And I think that's hugely important. Therefore, for people with a dual diagnosis, it will no longer be necessary to establish whether a mental health difficulty is the primary issue in order to access the support of a community mental health team. On this basis, the policy recommends a tiered model of integrated service provision for people with a dual diagnosis to ensure clear care pathways and improved outcomes for individuals and their families. Of the additional 50 million allocation to mental health in budget 2021, 23 million is dedicated to commencing implementation of many of the short-term recommendations in Sharing the Vision. This includes the expansion of the clinical care programmes for dual diagnosis. To date, a draft model of care for dual diagnosis has been developed based on international best practice and the experience of the National Working Group. It takes account of service users' views and describes the clinical care pathways for individuals with integration across primary care, substance misuse, community mental health and acute services. Significant progress has been made on the recruitment of a national clinical lead and a programme manager for dual diagnosis. Successful applicants have been identified for both posts and have accepted the roles. The start dates are currently being negotiated. Once these 2 key posts are in place, a multidisciplinary steering working group will be established to finalise the model of care and will identify pilot sites to commence the dual diagnosis programme. This government has prioritised support for families and individuals facing homelessness. A common challenge facing people who are homeless is addiction and mental health difficulties. Minister Fian, who has responsibility for public health, well-being and the National Drug Strategy, has allocated €4 million to address the addiction and mental health needs of people who are homeless. These measures include providing health supports for new tenancies under the Housing First programme, developing and delivering a customised health care plan for single people living in emergency accommodation, and providing additional services for people who are homeless with complex health needs, including chronic mental health and inpatient treatment services. In addition, people who are homeless will benefit from additional funding of €11 million under COVID-19 specific initiatives in the Winter Plan and the COVID-19 Pandemic Plan. Mental health development funding will also be available this year to enhance specialist mental health services for people who are homeless and have severe or complex mental health difficulties. This includes the appointment of a consultant in the North Dublin Homeless Mental Health Service covering CHO 9, following recent approval of the post. Similar plans are in place for South Dublin Homeless Mental Health Services covering CHO's areas 6 and 7. The new consultant in CHO 9 will be afforded admission rights to 3 acute mental health inpatient units where needed, and will have the remit to work with individuals who are released from prison and require specialist mental health care. A HSE service improvement project that was established in recent years to enhance mental health services and supports for people who are homeless was paused in March 2020 due to the pandemic. The knowledge garnered through this project continues to be utilised by HSE Mental Health to drive improvements in this important area. People experiencing homelessness can also access general community mental health teams and mental health supports within the primary care sector. A range of dedicated mental health supports for people who are homeless are also delivered through HSE-funded community and voluntary groups, including Merchants Quay Ireland, in addition to Safety Net and Dublin Simon Community. I would like to take the opportunity to commend the work of these organisations, including the mental health supports provided through the clinical nurse specialists at Merchants Quay Ireland, and I was delighted to meet one of the clinical nurses recently, and we had a really good conversation, and I got a real understanding of the challenges that you face on a daily basis. It is imperative that the valuable services provided through our NGO partners are sustained and they continue to be supported to meet current and growing demand. More broadly, mental health services and supports will be improved through sharing the vision implementation structures for people experiencing homelessness and addiction issues across a broad continuum of supports. These include mental health promotion, prevention, primary intervention, specialist mental health assertive outreach teams, in addition to housing, education and employment supports to enhance social inclusion and recovery. I know we have a huge amount of work to do. I know the very many challenges that everyone is facing, because when you talk about mental health supports prior to COVID, and now we're dealing with the COVID pandemic as well, so I'm not under any illusion as I talk to you about what will be put in place, that I want to work very, very closely with you and make sure that you have the sufficient resources that you need to do the work that you do every day of the week. The work of the National Implementation and Monitoring Committee on sharing the vision is progressing since its establishment late last year. The committee is tasked with driving and overseeing the implementation of the policy's recommendations, including those relating to dual diagnosis and homelessness. I am, as well as the government as a whole, fully committed to the continued development of mental health services and supports and ensuring access and appropriate care for particular groups of individuals, including those experiencing homelessness and people with a dual diagnosis. Of course, this will require a cross-sectorial approach, including social inclusion and mental health, to ensure the mental health needs of these groups are appropriately met. I would like to take the opportunity again to congratulate all those involved in the production of this report, both at Merchants Quay Ireland and HSE ACCES. I am confident that the research being launched today will have a positive impact and will enhance the mental health, well-being and quality of life outcomes for people experiencing homelessness, those with a dual diagnosis of addiction and mental health difficulties. And I just want to say thank you very much, and once again to congratulate you all in Merchants Quay for all the work that you're doing on a daily basis. It is very much appreciated by me as Minister. Gorv Mahavat.
Thank you, Minister Butler, for your kind words and your support, and for taking the time to join us today, because I know you have to leave shortly to attend a Dáil session. But just before you go, I'd just like to I suppose, respond to some of the points you made and say, firstly, I very much welcome the allocation of resources and funding to the clinical care programme for dual diagnosis and mental health services. We know there's been a lack of access to treatment for those experiencing dual diagnosis. Those that we care for and support have been let down in the past through the lack of joined up thinking in supporting them to address their substance use and mental health difficulties in a holistic way. There needs to be greater collaboration, as you've mentioned yourself, between mental health and addiction services to ensure the best possible outcomes for service users and patients. And as you mentioned, it is very important that the voices of those that use services such as Merchants Quay and HSE ACCES are heard and considered when planning the implementation of the sharing the vision, which, as you said, is an inclusive vision for everyone. And thank you for recognising the invaluable contribution of the voluntary community and outreach health services. I ask that you continue to work with us to ensure that we have the capacity to meet all the needs of our service users and patients, and to ensure that our services are sustainable into the future. And lastly, on behalf of both Dr. Joanne Fenton, myself and our teams, can I say that we would be delighted to support you and the strategic implementation team to realise the government's vision for the future of mental health services and help make it a reality, as it can only make for better outcomes for our services and patients into the future. So many thanks, Minister, indeed, for joining us today. Much appreciated.
Thank you, Paula. Thank you, Paula. You were very, very, very kind with your words, and I look forward, hopefully, as soon as we can, you know, as we progress through COVID, and thankfully, you know, the good news that we are rolling out the vaccine. 100,000 people received the vaccine this week. But when we exit level 5 and you know, we go back to some form of normality, I would look forward to going to visit you at your premises in Merchants Quay and to see firsthand the work that you're doing. So I look forward to meeting you again soon in the future. And best of luck today.
Thank you very much.
Congratulations again.
And thank you. You'll be very welcome. Thank you very much.
Thank you very much.
Thank you. Now, just to continue proceedings, as I said, the Minister has to head off now for a session in the Dáil. But just before I invite Kathyan to present the findings and recommendations of the report, I'd like to just welcome Deputy Thomas Gould, who joins us today. As you know, both Deputy Gould and Deputy Ward have proposed legislation to the Dáil, dual diagnosis, no wrong door. And I think we all agree that it's so important that services are available when clients need them. And regardless of the service they attend, we need to ensure that they have the necessary supports to address both their addiction and mental health difficulties. So I'd like to invite Kathy to present the findings of the report, and I'll welcome Dr. Joanne Fenton, who will join Kathy after the presentation at our Q&A session. Thank you.
Thanks very much, Paul, and thank you, Minister and Deputies and everybody for attending. I'm just going to pull up the slideshow. So, okay, so as I said, can everybody see that?
Not at the minute, Kathyan, no.
Okay, all right. Oh, is the way it was working fine earlier?
Oh, I think it's coming on now.
Okay, great.
Yeah. It just needs, yeah, we can see it now, Kathyan.
Okay, great. Sorry. Okay. So it's not coming up fully as it should. I'm sorry about that, folks. I don't know what's gone wrong there.
It's coming up on my screen now, Kathyan.
Okay.
So
it's only coming up outside, so I can't get into slideshow. Hold on a second. There we go. Sorry about that. The joys of technology. Okay, welcome and thank you very much, Paula and Minister and Deputies, and for everybody for attending. So, as Paula said, The research study was focusing on the effects of COVID-19 on people experiencing mental ill health, substance use disorder and homelessness or housing insecurity in the Dublin region. A few people we need to thank, most importantly the participants. As Paula said, they were very generous with their time. They were also very articulate and very engaged in the research, and I really want to thank them for participating. I want to thank both Merchants Quay Ireland and the HSE ACCES team for facilitating the research, and particular thanks to Amy Carroll at Merchants Quay for the very onerous task of organising interviews in the middle of a lockdown. We asked a scientific advisory team to provide support and advice, and I particularly want to thank them. That's Dr. Kieran Harkin, Dr. Susie Lyons and Dr. Paula Mayok. And also I want to thank Miss Audrey Watt. So the research study, I'm opening with a quote from one of the participants who really underlines the need for outreach services. This is David, who has a severe mental ill health issue. And in context, this was early summer last year, so things weren't as bad as they are now. And he talks about a decision to commit suicide. He said, I suffered delusions. It got to a head one Friday night. This was in the middle of lockdown. I wanted to commit suicide. I was going to go to another country and commit suicide. And for some reason, I came back to get my laptop. And there was some texts on my phone from my psychologist. And it made me question my assumption that they no longer wanted to treat me. So I re-engaged and I kind of told them what was going on, and they felt it was best that I go to hospital for a little while. It's kind of hard to imagine how somebody would feel like this, but in reality, if David hadn't had that intervention, he might not well be with us today. So what did we set out to do? We wanted to explore the lived experiences of the COVID-19 pandemic for people engaged in services within both Merchants Quay and HSE ACCES. Specifically, we wanted to look at the challenges they were experiencing around services in particular, and to see how these service changes had impacted on their mental health and other areas in their life. So we focused on this group because we knew that COVID-19 had a profound effect on service delivery for both organisations. This cohort, so that's people experiencing mental ill health, homelessness, or substance use disorder, are defined as a vulnerable group. A vulnerable group is any group of people that share certain characteristics that puts them at disadvantage from the rest of society. One of these characteristics would be that they already are quite socially excluded. And the problem with COVID-19 control is that it focused on self-isolation and reduced social context, which was going to be difficult for a group that was already socially excluded. And we knew that there was a limited awareness of the impact of restrictions on their mental health. Study design was qualitative, so that means using open-ended interviewing techniques to allow the participants the space and time to explore their own lived experiences of what was happening in their lives on a day-to-day basis. Sampling and criteria for the study design was purposes, so we recruited participants who reflected broadly the demographic service use within both Merchants Quay and HSE ACCES. Merchants Quay and HSE ACCES acted as gatekeepers, so this allowed us to ensure that all of the participants in the study were adults, they were over 18 years of age, that they had capacity to give informed consent, and that they had an experience of mental ill health, substance use disorder, homelessness, or any combination of the three. So recruitment and data collection took place between October and November 2020. And I know we're now in the middle of wave 3, but it's important to put this into context. So at this time, we had had a reasonably nice summer. We had come in and out of fairly light restrictions, certainly in comparison to where we are at the moment. And it was before wave 2, or just at the onset or the beginning of wave 2, and certainly before wave 3. So there was 10 participants in total. 5 were from HSE ACCES, and I was able to interview them face-to-face without support. But by the time we got to interviewing in Merchants Quay, it was a more severe lockdown. So 2 of those interviews were conducted by Zoom without the support of their caseworker, and 3 opted for phone interviews without the support of their caseworker. So just a brief participant profile. We interviewed 6 women and 4 men. The average age was just over 40 years. They were all unemployed at the time of the study. 6 were single, 3 were separated, and 1 was widowed. And 5 of the participants had between 1 and 8 children. a profile of their mental health, substance use and housing profile. 5 of the participants had severe mental ill health, and this includes schizoaffective disorder and bipolar affective disorder. 5 experienced depressive illness. On substance misuse, 5 reported mental ill health and substance use, either at the time of the study or in the past. 4 reported mental ill health and alcohol use. 2 had severe mental ill health with no substance use. Housing status, 5 lived in hospital accommodation at the time of the study, 3 were housed and 2 were street homeless. And they had spent, on average, 5 years homeless, but that ranged from 9 months to 18 years. So the findings are really directly coming from the participants. So first of all, we discussed their challenges around their mental ill health, substance use disorder and homelessness in general, not just around COVID. How they felt about contracting COVID-19, what service use was like for them before the restrictions and after the restrictions, the factors that they felt were important around social isolation and loneliness, the effects of the restrictions on their mental health and on their substance use. And because there's a move to tele-psychiatry and tele-mental health, looked at their capacity for online support. So just talking about the challenges around mental ill health, Margaret and Peter both have severe mental health illness, and they talk about the difficulty that they would have experienced throughout their lives. Margaret said, "I've often taken overdose, any sort of drug, as long as I thought I was going to die. Just family problems. I used to get socially mixed up, you know, and then I'd end up in prison for public order offences." Whereas Peter says that he always felt a little different. Even when I was in school, he said, I wasn't functioning as well as other people. I ended up in the lower classes. I had no one to talk to. I didn't have any outlets to discuss it and try regain it. So I gave up school in first year. So that points to a kind of a long-term lack of diagnosis in younger years. When talking about challenges on their substance use, both Sandra and Sean had been drug-free or in recovery at some stage. So Sandra said, for the last 2 years now, I'm actually going kind of strong on my methadone. Don't get me wrong, she said, I've had a couple of slips. I ended up getting very bad again on the drugs. I used to be tablet dependent, like on benzos, but I detoxed myself off them. And Sean talks about having been in rehab for 3 months prior to COVID. He said, everyone kept on telling me that it was going to be tough, and I knew I needed it. It brought me back to life. It turned the light back on inside me, you know? And challenges around housing. As I said, average length of time homeless was 5 years, but it kind of went from 9 months to 18 years. And there was a discourse around intergenerational homelessness. Sandra, for example, she said she was on her own with her daughter. It was a beautiful apartment, but she was getting intimidated. One day, she says, I got a knock at the door on my apartment block, and I opened the door and got a smack of a Budweiser bottle in the head. My apartment was broken into twice. And I asked for a transfer, and the council told me I'd be better off announcing myself homeless in town. I didn't want to bring my daughter to hostels to have the life I've had. So I asked her grandparents to take her. I was told I'd only be waiting a year, but that was 7 or 8 years ago, and I still haven't been rehoused. So this gives you a sense of what was happening in their lives prior to the pandemic. I also asked the participants about their fear of catching the disease, but to be honest with you, their day-to-day struggle in just existing was so overwhelming for them that the thought of catching COVID wasn't really important to them. So Sean here said he was only worried about catching the disease in the last couple of days because he'd heard from his brother that he had a young relative that was diagnosed with COVID. And he said, I just text my brother and he says she's symptom-free at the moment, but it's an awful worry. Miriam talks about the difficulty of trying to provide her own PPE out of limited budget. I always have my wipes and my hand sanitizer. I get that regular. I buy them myself now and it costs a lot of money. So pre-COVID service use for Margaret, who was linked into HSE ACCES, was very informal. She said you could come in and ask to see the doctor or something. They'd be able to look for anything you needed, no problem. I could chat to all of them. Pauline, similarly, for her access to Merchants Quay before COVID, said when she was first homeless, she used to feel safer there at Riverbank sleeping than in a hostel. She said, I used to come in and have dinner and chat to the mental health staff, all the staff here. They can recognize if you're not your normal self, and if you need to talk, they'll bring you to a private room and have a chat with you, let you know that they're there for you. Post-COVID service use obviously had changed and had become much more restrictive. David, whose quote opens up the actual, the first slide on this presentation. David talks about the extreme isolation. He said, I was basically not seeing anyone. I'd get a phone call now and then from my psychologist, and because COVID was new, people didn't really know how to deal with it or handle it, and services were just adjusting themselves. David had an underlying physical health condition as well as a severe mental health illness, and there was agreement that he wouldn't travel in for treatment. So he said, I just kind of agreed with my psychologist that I should stay at home. To be honest, it was fine at first, but yeah, I missed the interaction. And Pauline said about Merchants Quay, not being able to drop in, she said, yeah, the staff here are like my family. I've been coming here since forever and they're a family to me. The support they give and all that. Again, post-COVID service use and outreach. So outreach is really important for the people in this study. And Peter here talks about the reassurance that it provides. And Sinead talks about how nice it is just to see new faces. So Peter said, I had someone from here. She was always ringing me and would always arrange to meet me to go for a walk and things like that. She just kept me reassured and she was always there for me if I needed her. Outreach is important, definitely. And Sinead said, and she's street homeless, she said, they basically come up to me every morning to see how I'm doing. It's brilliant that way. It's nice to see different faces as well. They all talked about social isolation and loneliness. Many people in addiction and many people who are homeless and many people experiencing mental ill health have no contact with family and don't have social networks like friends. So Sean says, the hardest thing about COVID is the social isolation with my family and stuff. Like I haven't met up with my siblings. I have been on the phone to a few of them, but I haven't been invited out to their house or anything. I kind of noticed that, you know. And David said that most of his friends are drinkers. They like a few drinks. So if the pubs aren't opening and nobody's going to the pub, he doesn't meet up with his friends. The participants also talked about the effects on their mental health. So for the participants with severe mental ill health, 2 had required hospitalization. And that was, as I said again, at the early stages of COVID and restrictions. 1 reported increased depression and anxiety. For those with depressive illness, which was 5, all reported increased depression, and the majority report increased anxiety, and 3 reported suicidal ideation. Roisin here talks about her anxiety and depression living in a hostel. She has a severe mental health illness. I had to share a hostel with 3 other girls, and 2 of them were heroin addicts, and they used to shoot up in the room. They'd be injecting the heroin into their feet in the room in front of me. I was terrified. It was very distressing. I was crying my eyes out. It's been really tough. Sinead talks about suicidal ideation. I had thoughts, she said, because I suffer with depression. I'm feeling very vulnerable, and I know people do something and they don't talk about it. They just go off and do it. I don't want to do anything stupid. They also talked about the effects of their substance use. So 8 of the participants were involved in substance use, either at the time of the study or prior to the study. Of those, 4 were using alcohol. So 2 reported reduced alcohol intake because the pubs were closed, but 1 reported increased alcohol intake because he was lonely at home in the evenings. For those participants with substance use disorder, the majority, and that's 4 out of 5, reported a return to substance use, having been in recovery or drug-free prior to the restrictions. Miriam explains the difficulty of moving on in recovery. She said, you can't stand still in recovery. You move forward or you move back, whether you know it or not. Like I used heroin yesterday and I hadn't used in 6 weeks. It was a huge, huge blow for me that I lost 6 weeks. But at the same time, it makes me very angry because if I got the help I needed, I wouldn't be in this situation. Sandra talks about her deteriorating health. She says, I'm on the verge of going back on drugs and I don't want to because there's nothing there. There's no one there for me. There's no support for me. With the move to telemedicine and telepsychiatry, I asked all of the participants what their capacity for online support was. So 3 have internet access, and that's either a phone and or a laptop. Incidentally, these 3 participants are all housed. 4 have mobile phones with no capacity for internet, and 3 have mobile phones with internet capacity but no access, either because they're street homeless and there's no way of charging them, they have no Wi-Fi access because they're street homeless or in a hostel, or they're on a low income and they can't afford credit. Sinead said, it's very hard to charge up the phone because there's nowhere to charge them. The phone could be dead for weeks and that's it. Sinead is street homeless. Miriam, who's also street homeless, talked about an online counselling session. She said it was fine, but it wasn't the same. I know with COVID-19 you can't be near people, but I also had a counselling session that was face-to-face with somebody as well. And that did me so much more than the online thing, because you don't feel a real connection to that person. And my partner was with me, and you won't say, there's certain things you can't say. So exploration of needs going forward, because 7 of the 10 participants were not housed, housing was really important to all of them. Roisin explains it makes her very anxious. She said, I'm unemployed, I have a mental health problem. It's going to be very difficult, impossible to get somewhere to rent. I don't think landlords will want someone on HAP or with mental health problems. I just wish there was more social housing for people like me. I'm terrified living in the hostel. I have no space and I can't cook good food. And there's a lot of drug use, but I can't see myself ever getting a place of my own. The recommendations then are focused on the very real need to attend to the psychological impact on the pandemic for this group. So the first recommendation is around ring-fenced funding for mental health, which would allow the services to adapt and respond to needs during emergency situations. It would also allow services to gain direct access to counselling services for those most in need. So certainly for some of the participants that were borderline toying with the idea of suicide, that would be really critical. Mechanisms need to be put in place to facilitate face-to-face engagement. And there needs to be an ability to engage with healthcare professionals without the requirement to have phone or internet coverage. There also needs to be increased outreach staffing and funding. And services also need to look at providing an in-reach-based service to hostels or those in private emergency accommodation. There is a need for the establishment of substance-free recovery support hostels, particularly for those people with poor mental health. Establishment of safe spaces for homeless women and gender-specific services for women who use substances. Recommendations for future research focus on planning for the development and delivery of services should always have at its core the direct input of service users through formal consultation. And we would like to see a study extension to follow up with the same participants as the pandemic progressed and with the onset of winter. So I'd like to thank everyone, again, most importantly, the study participants who were so kind and generous, articulate and warm. Merchants Key and HSE ACCES, the Scientific Advisory Committee, Amy Carroll in particular, Merchants Key, and Audrey Walsh, as well as all the attendees. Thank you very much for taking the time to attend today, and I'll hand back to you, Paula. Thank you.
Thank you, Kathyan. And again, I just want to support and thank everybody that participated, particularly the participants, but equally the teams. I think it's a really important study that has a lot of learnings for us all across the sector in supporting service users and patients. So I'd like to welcome Dr. Joanne Fenton, who's joining Kathy now for this Q&A session. There are a couple of questions I'd like to pose to both of you. I'll also keep an eye on time because I promised to finish up as planned by 1 o'clock. So can I firstly ask you, Joanne, having read the report and listened to the presentation today, can you share with us your reflections on the findings and recommendations of this research?
Thanks, Paula, and thanks, Kathy, and to all attendees. I think it was wonderful to have the opportunity to be part of the study, which really highlights the need for this vulnerable cohort of patients. Those that are attending the ACCES team, as Kathy mentioned, are homeless, have severe and enduring mental illness, and some of them use illicit substances. And COVID has had an impact on all of society, but particularly this group, which have been more, I suppose, identified with social isolation and a relapse of their mental health, with 2 of them requiring a hospitalization. But I think it's really relevant to air this study now because, you know, COVID has been around for at least the last 12 months, and this is something that we're going to continue to live with. And so we need to learn how to support our patients into the future. So I think that's really, really relevant. Just, I suppose it's clear that mental health and substance use disorders, they need to be treated in unison, and that's already been highlighted, and the services need to be resourced in this way. Our services, they need to adapt to COVID-19 with certainly more outreach services. But as well as outreach, which I know both Merchants Quay and the Access team provide, we also need to get back to the day services and to education and vocational rehab, so that our patients have meaningful activity during the day, because again and again with COVID, they're socially isolated, and with more activities, they have more social connection, and that will improve their mental health. And there is value to providing online support, but again, we need to listen to the voice of the patient and be able to provide both online and one-to-one connection. So there are a couple of my thoughts.
Thank you, Joanne. And I suppose the pandemic has highlighted for us all the importance of human contact, as indeed you've mentioned it yourself there, and the importance of services like day services and the opportunity for people just to come in and say hello. But obviously COVID-19 has forced many of the day services to change in order to keep people safe. And as a result, we've witnessed our clients who are already experiencing discrimination and social inclusion become further isolated. Kathyan, can I ask you, if the participants were sitting here today with us, what would they tell us that they need the most?
I think a couple of things. Well, I think certainly for the people who in the study, the 7 of the 10 who were homeless, they would feel that housing was really important. For those with mental health issues and for substance use, they really need wraparound supports for that. But I think what they need most of all is just to be a part of society as opposed to apart from society. They really need human contact. You know, day services were so important to them. HSE ACCES and Merchants Quay are acting as their de facto family in the absence of their own supports and friendships. So that's really, human contact is huge.
And I think that's the feedback we're also getting from our outreach teams in terms of that, you know, just seeing a face when people are out on the street. And it's clear to us all that, you know, mental health, substance use and homelessness are inextricably linked and can never negatively impact each other. And while I very much welcome the Minister's comments earlier and the government's commitment to increasing resources and fundings around dual diagnosis, Joanne, can I ask, what would be your hope for the future in supporting people with substance use and mental health difficulties?
I suppose my hope would be that substance abuse and mental health difficulties would be included, just that one isn't an obstacle to the other, and that we're working together. Pre-COVID, there was interdisciplinary meetings with substance abuse providers and mental health providers and housing support, and we worked together with a clear vision and a shared vision to support the patients that we look after, because certainly within homeless services, they're all very much intertwined. So I suppose just working closely together and providing adequate funding for those services would be my hope.
And I think I have to say we've seen the positive outcomes for our clients with the joined up thinking between ourselves, yourselves and other participants in that multi-D approach. Can I just pose a question to both Kathyan and Joanne? There's much talk about the digital divide in society, and the research suggests the online support solutions are not working for all our service users and patients. On a purely practical level, how can we support people to access a service which may require using technology, and are IT-based solutions viable going forward? So I'll pose that to Kathyan first, maybe.
Thanks, Paul. I think IT solutions will be certainly viable for some people. I have thought a lot about this. You know, you could look at, you know, street infrastructure, you know, providing Wi-Fi benches where people could charge up their phones. But the reality, you could provide phones to people, you could give them money for credit. But the reality is that there will always be a cohort there that will neither want nor have the capacity for online support. Having said that, for the group that it does suit, it might free up space for the people, you know, with regard to funding, who need more outreach. There may well be people for whom, you know, telemedicine and telepsychiatry will work very well, and that'll be interesting to see going forward. But certainly for this cohort, my understanding from what they've said is that face-to-face contact is absolutely crucial for them.
Thank you.
I suppose I would echo that as well. Recently within the ACCES team, we have had the opportunity to get laptops on site so some of our patients can come in and use them, but it's an absolute choice. And also there needs to be education about using, I suppose, the internet and online facilities. With Zoom and Teams and whatnot, I always turn to my children for a bit of support in that respect, because they're much more adept at it. But we have to be able to give people a choice. And for many of our homeless cohort, they don't actually have access, as Kathyan mentioned. So I suppose to be considered, but not the ultimate. I think you can't beat face to face.
Okay, Joanne, thank you. And Joanne, can I just ask you then, just given the impact on the pandemic on mental health and the fact that the pandemic is going to be with us for some time, what further supports do you think we have to introduce to improve the level of service we offer?
Well, with relation to support, I suppose we need to increase the availability of services. So I think we need to reopen the services. We need to reopen day services and have our patients able to come in and meet us, as well as providing outreach. And we need to do that in a careful way to minimize COVID. But I think the face-to-face is very important. Other things would be including service users in the decision making, and asking the teams and the services what would be the best use of resources and where they should be targeted. I think there needs to be transparency in relation to how monies are spent. But the service users, even in the study, you can see that they know and they're able to state what works best for them. And then what was also mentioned was the hostel provision. So I think with regards to housing, there needs to be some strict policies with regards to some hostels being as strict with relation to substances, so that we'll be able to include some of the patients that are afraid and that are sleeping rough at the moment to move into hostels. And then the idea would be that there would be a stepwise move into their own accommodation with wraparound services. So I suppose in short, it's including patients and service users in the decision making, and asking the teams and transparency, ongoing support.
Okay, Joanne, thank you. And I suppose, within this, there has been two teams who have done amazing work, and to acknowledge that both in both our teams in MQI and HSE ACCES. And they've gone to extraordinary lengths to support people and to keep them safe in these unusual times. So we need to be mindful of our staff. And I suppose the question I'd like to ask is, what additional support should we be putting in place for our staff?
Well, I'm lucky in the ACCES team. I work within a multidisciplinary team of nursing, occupational therapy, social work, and psychology, and they have really gone above and beyond with COVID. Certainly services shut down first, but they were trying to be innovative and think of other ways to connect with patients. I think that it's very important that the teams and the staff are able to voice their concerns, and when they're on leave, that there's adequate coverage so that they can actually take their downtime, and they don't need to be kind of thinking that they're not supporting the patients when they're on leave. I think that's very important. I mean, the work that we do is very, very challenging, but it is also very, very rewarding, and we're very privileged to be in that position. So it's to highlight that.
Okay. Now we have some questions still coming in from attendees, and I'll pose this question both to Joanne and Kathyan. And a question has come in about, what gender specific services for women would you recommend?
I kind of nearly put this one back on you, Paula, because I know you're doing work on that at the moment. So you've got a project underway at the moment. I certainly, from what I was hearing from the female participants, is that they don't feel safe in hostels. They don't feel safe on the street. I know that, coercion, abuse, domestic violence can stop and limit a lot of women looking for service, and their needs are quite different, because out of the 6 women in the study, 5 of them had children, but 4 of them had no access to their children. So their needs are very different to men. So I'm going to put the rest of it back on you, Paula.
Yeah, no, and I suppose that echoes, you know, what came out in the study we conducted last year, and even talking to the service users that attend Merchants Quay, is that need for safety, both in being able to talk about the trauma they've experienced in their lives, and having a safe space. So I think that's something that we want to progress this year, with the hope that we will be able to implement a gender-specific service, and one of the initiatives that we're hoping to do in the coming weeks is a female-only detox in St. Francis Farm, because I think certainly the need for female services in detox and rehab came out strongly when we spoke to the aftercare group. Joanne, have you anything that you'd like to add before I pose another question to you both?
I think it's just important. I suppose we see men and women on the ACCES team, and we would probably have more men than women on the that attend the service. But I think it's just recognizing the difficulties in relation to domestic violence, and the emotional threats can have an impact on their mental health, and it's really building up the rapport with the patient so that they feel safe to tell you that, and we can use, I suppose, additional supports then moving forward to ensure that we're looking after their mental health.
Okay, and another question that has come in is, what do we expect to change as a result of the policy change for integrated services for people with dual diagnosis?
I think that's probably one more for Joanne than it is for me. I mean, I certainly, you know, listening to the participants, most of them would have, you know, particularly for those with an enduring or severe mental health illness, they would have not been diagnosed in their younger years. You know, they might have seen onset or been aware of difficulties in their early teens or early 20s, but it got misdiagnosed. And in some instances where they have maybe, you know, dabbled with some substances, or, you know, as a form of an escape, or just because it's socially acceptable, and then they have gone looking for help, they keep on falling between these two stools. No, we can't treat you because that's a mental health issue and we're a substance use organization, or we can't help you because we're a mental health and that's substance use. So, you know, there's certainly, you know, a discourse around that with the participants, constant missing the bigger picture and the combination of the both, you know. So I would like to see that change, that it doesn't matter what and it doesn't matter, you know, if it's mental health first and then substance use, or substance use first and then mental health. You have both. You're presenting. You should get help. Simple as that.
Okay. Joanne, have you
I suppose it's very important if there's greater collaboration between substance use services and mental health services. If they're brought more together, then that will be a benefit for the patient, and that there isn't that separation, and that they feel that their needs can be met. Equally, like in housing, there needs to be wraparound services, and people need to, I suppose, consider all aspects of the individual, so that they can improve their well-being. So it's really, really important.
And I think that echoes the experience we have, where people have presented to mental health services and I suppose have been turned away or referred back out to deal with their addiction before they can deal with their mental health illness. So I think it can only be better outcomes for the people that access our services to have both addressed in a holistic way, and not that divide, that it's one or the other. And I think it's also about having the supports within our services to understand the mental health aspect of dual diagnosis as well as the addiction. So for me, there's also some training across addiction services and mental health, and vice versa. I think will be beneficial for everybody to be able to treat clients in a more comprehensive way. Another question has been asked is, how feasible is change during the pandemic?
I think it has to be, because we don't know how long it's going to go on for. So I think we don't know, but we have to aim to do the best for everybody. And you can't stand still. It's a bit like, you know, Miriam talking about recovery. It's not about, you know, you move back or you move forward, but you can't stand still. And we can't stand still in the middle of a pandemic, difficult and all as it might be, to try and change things.
I think change is always happening, and with the first lockdown and the first recognition of COVID, we were very nervous, and many of the services kind of closed and shut, and now we've recognized, well, we have to keep moving, we have to keep engaging, because that's this is the work we do. We're looking after people. We need the very best for them. So we have to move things forward. COVID is not an excuse to step back, but only to move forward and provide the best care that we can.
And I think from HSE perspective, you know, we've increased our capacity around outreach, and I think that has been vital in terms of sort of adapting to the pandemic, but we're equally trying to prioritise complex cases and people that have really complex issues to get them into the building. Obviously access to our primary health care, including the mental health team, is face-to-face and online. But I suppose for us going forward, we're planning to hopefully be able to have people back in when obviously we're safe to do from a COVID perspective. And I suppose there's some hope for us in that we see vaccinations coming down the line in the next few months, which hopefully will help us at least see increased access on a face-to-face basis. Just one question again then, are there volunteer support services there to help with these people in an outreach capacity? If not, why? And I suppose just from my perspective, I suppose we have our outreach teams out on the street, as does Dublin Simon. So there is access. We do meet people on the streets. I don't know whether Kathyan or Joanne want to add anything to that.
Just on the access team, we don't have any volunteers. Often we'll have student placements from nursing, social work, or occupational therapy, and that'll just increase I suppose the numbers. But we don't work with volunteers.
And then the last question is, what percentage of service users have contracted COVID? And I suppose that greatly influences future supports and services. I can certainly say that the percentage of clients from a homeless perspective has been very low in terms of COVID, certainly at the very beginning. I think that's been one of the successes in that having the cocooning and shielding units and being able to get people in and into safe spaces has been really important. I think now there's a lot more COVID in the community, and we need to mind the clients, because it's reversed itself, I think, in a sense that we're actually nearly a bigger risk to those that access services are on the streets. I don't know whether Joanne or Kathyan would want to add to that.
Just in relation to the patients attending the access team, some of them have needed to self-isolate with, query COVID positive, but in fact they have turned out to be COVID negative, which is great. I know there's been some outbreaks on some inpatient wards, but just with regards to our outpatients, we've been lucky enough they've been lucky enough to remain COVID free, and long may it last.
I think that draws us to an end of all the questions. Joanne, Kathyan, before we finish up, is there anything you'd like to add?
No, just I want to thank again everybody for attending, and both of you and both organisations and the participants. They were just so lovely, and it's just been an absolute privilege to work with them. So thank you.
Yeah, I'd just like to thank everybody for attending, and delighted that this research has come to the fore, and hopefully we'll be able to continue it in the next kind of 6 months. Thank you very much.
Okay, and I'll just finally add my thanks to both Kathy and Joanne's, to the participants, the teams, the scientific advisory team as well, and to acknowledge the attendance of Minister Mary Butler for joining us. Kathy and Joanne, thank you both for the presentation and the very engaging Q&A session. And I suppose we just need to continue to talk about mental health, even after we get back to whatever normal looks like, to continue to reduce the stigma and discrimination through improved understanding of mental health difficulties, and importantly for all of us to continue to be the voice of those who use our services and to advocate on their behalf. So just to finally finish, thank you all for taking the time to join us, and I hope you found this webinar interesting. Thank you very much, everybody.